Thank you, Jason. Happy Friday, everyone. So, my story today comes from Normal. Arizona officials will no longer pursue most cases involving prenatal cannabis exposure. Arizona state officials will no longer take positive actions against people who consume medical cannabis during their pregnancy. The decision announced by the Department of Child Safety last week comes nearly 1 year after Arizona State Supreme Court declined to reverse a lower court decision allowing physician authorized use of medical cannabis by pregnant women. The decision supports the idea that medical cannabis use during pregnancy does not constitute neglect by the mother. Lawyers for the Child Safety Agency acknowledge that they do not possess the legal authority to investigate cases of prenatal cannabis exposure unless there are explicit allegations of neglect. The new policy takes effect in January. Studies consistently show that Black and Hispanic pregnant women are disproportionately ordered to undergo drug testing during labor and delivery. In certain states, like Alabama and Oklahoma, pregnant women who consume cannabis frequently face criminal prosecution, even if they have a physician-approved recommendation. Data assessing the relationship between cannabis use during pregnancy and neonatal outcomes are inconsistent. It's unethical to perform prospective clinical trials. As a result, many studies observe cannabis use in the community. Illegal behavior is often associated with negative health outcomes. Socioeconomic and environmental factors confound observational data. Correlation is not causation. Consuming cannabis in poverty is different from consuming cannabis in wealth. As noted above, some states, even with medical cannabis laws, consider consuming cannabis while pregnant a crime. Obstetrician and Hyatt 9 correspondent Dr. Felicia Dawson commented yesterday in an online presentation that pregnant women are now at the front line in the battle to normalize medical cannabis. Hyperemesis gravidum is a serious condition where pregnant women experience nausea and vomiting. It's more than morning sickness, resulting in preterm labor, low birth weight, and NICU admissions if left untreated. Depression during pregnancy is associated with poor outcomes to the mother and child. Prenatal anxiety is also a risk factor for adverse health outcomes. The relative risk of negative outcomes from these conditions favors the use of cannabis, especially considering recent data from the University of Maryland and Virginia Commonwealth University noting no difference in neonatal outcome among pregnant women, cannabis users, and non-users in 4 different cohorts. It's good to see that the law in Arizona acknowledges the science. What are your thoughts? This is Dr. Jean Talleyrand for Hyatt 9 News.
Shout out Dr. Felicia Dawson getting that little quote in there.
Yeah.
Dr. Felicia in the building.
Mm-hmm.
Hell yeah. I did not do this story because I didn't know if I could get through it because it hits me so close to home. So you mentioned hyperemesis gravidarum. So someone with morning sickness, it's a bad cold. Hyperemesis gravidarum is like COVID, right? That hits you hard. It is a hurricane versus a storm. And I have what's called cyclic vomiting syndrome. Those of you that remember the movie The Day After Tomorrow, it's worse than hyperemesis gravidarum. And I was prescribed several things that have never been tested on pregnant women or babies, but I will share with you that after my first was born, after taking Zofran, that's when all the television commercials started about how many birth defects, some of which are obvious and some of which may not present for decades, heart problems, developmental problems, from Zofran in the first trimester, which is exactly when they prescribe it for morning sickness, with no testing on mothers or babies for those outcomes, except the lawsuits. And the damage psychologically to both babies and moms with what you're talking about and then being removed from each other. And I'm also just going to point out that not all these removals are even founded in science or reality. Never mind that cannabis has been found over and over to be no more harmful than many things we commonly consume, including studies of moms and babies in Jamaica, but that in 12 out of the 14 indicators, the children of the moms who did consume cannabis in utero and after had better outcomes. That's 12 out of 14 children had better outcomes. Once those outcomes were reported, that study was immediately stopped by the federal government and attempted to be buried. There are so many cross currents here of a lack of testing of most medicines for pregnant women. And so everything is a no. But what we do also have is thousands of years of midwifery. And no matter what state you're in, you still have to be super careful about what you share with professional medical staff in a hospital or an HMO or a PPO, because they are required by law to report you. And as Dr. Talleyrand said, you are considered a child abuser. You are considered someone who either neglects or abuses your child because of this cannabis use. And we are still taking babies in hospitals, not just for positive cannabis tests, but for years, Johnson & Johnson baby soap would pop a positive, and babies are being ripped from their moms over a perception of cannabis use that's actually from the soap that they just used on that child. So the harm that we have done to families, and predominantly, usually poor families, right? And you talk about Black and brown and indigenous women who don't have resources to fight. It is women still being strapped down in Texas in chains to give birth. This is still happening in America right now, and I appreciate you bringing this to light, Dr. T.
Thank you for sharing that with us, Dale.
Mm-hmm.
Yeah, absolutely important. And, Dr. Dawson also expressed it very well yesterday. It's something we cannot forget. Putting pregnant women on the front line of this battle, I mean, we really shouldn't be doing this, or we should be joining them. They shouldn't be alone. We can't forget them.
And if you got a mom, right? If you love a mom, if you have a mom, a sister,
right,
a daughter, this is affecting dads too, and importantly, children. So many young Black boys did not grow up with parents because of that. They were put in foster care because their moms were taken as part of the conspiracy when their dads were dealing just to feed their family, Rico. We're not done yet, people. We are not done yet. And it's the folks that are still on the wrong side of the line of prohibition that we're still fighting for. Thank you.